Hi everyone, I'm Max, one of the exercise specialists from Belong. This is basic diabetes exercises part 2. If you want to go and watch part 1, you can click on our channel and look for that one. Belong is a non-profitable care organisation around the north of England, in case those aren't aware. Just a couple of ideas of what exercise can help with diabetes is being physically active is very good for management of diabetes, and some exercises to help manage this can be the likes of cycling, dancing, water aerobics, high intensity interval training, weight training, yoga, tai chi or Pilates, just to name a few. Now, what we're going to do some seated exercises. Now I've got some dumbbells down here. You can use cans out of the kitchen, anything that could be a little bit more resistance based. However, if you feel like just your arms are enough, use your arms. So we're going to start off with sitting up as tall as we can in the chair. We're going to bring our arms out beside us, and using our elbow joint, we're going to bring our hands in and out. We're going to do 10 of these. There's 2 and 3, 4, 5, stay as wide as you can, 6, 7, be very careful those next to you, 8, 9 and 10. Perfect. From here we're going to reach as high as we can, so keeping our hands in this position here. We're going to raise all the way up towards the ceiling and back down. We'll do 10 of these. It's 2, 3, 4, 5, keeping yourself up as tall as you can, 6 and 7, nearly there, 8 and 9, one more, and 10, perfect. We're going to give your upper body a little bit of a rest. We're going to go into a seated leg extension. So we're going to start off with the left leg. So we're going to bring it out in front of you, hold, squeeze this muscle, and back underneath. Do 10 of these, there's 2. Remember to squeeze, 3, and 4, 5, 6, as high as you can, 7, and 8, 9, and 10. Perfect. Moving on to the other leg, you should be your right leg. And there's 1, 2, 3, full extension, 4, and 5, 6, you can count along with me if you want, 7, there's 8, 9, and 10. Perfect. Okay, we're going to do 10 reps again. I'm going to stay up as tall as we can in the chair. I'm going to bring our knee up this time. Sort of like a march, we're going to focus on one leg at a time. So we're going to start off with my left leg. So if we bring it as high as you can, there's 1, and 2, 3, you can hold on to the sides of the arms of the chair if it helps, 4, 5, and 6, 7, 8, and 9, and 10. It can get quite difficult, bear with me, keep going. Onto your other leg, be my right leg, and 1, 2, 3, 4, 5, 6, very nearly there, 7, and 8, high as you can, 9, that's 1, and 10, perfect. I've got some dumbbells down here. Like I said before, you can use tins or anything you fancy that has a little bit of resistance to it. So what I'm going to do, I'm going to place my back against the backrest of the chair, keep my arm fully out in front of us, fully extended. Just using my left arm, I'm going to curl and I'm going to control. I'm going to do 10 of these. There's 2, so curl and control. 3, 4, 5, 6, 7, 8, doing good so far, 9, and 10, perfect. Now keeping a grip onto that dumbbell as well while we move on to the other arm. Should be onto your right arm now. So I'm going to curl and extend. So full control. There's 2, 3, 4, 5, and 6. Keep going. 7, 8, 9. Nearly there. 10. Perfect. Okay. Now we're going to use both arms at the same time here. So these are called hammers. So we're going to bring our thumb leading into this movement. So keeping our elbows by our side and our chest up. We're going to bring them together, leading with our thumbs at the top. We're going to do 10 of these. There's 1, 2, 3. So we're getting full extension in the arm. 4, 5, 6. That's it. 7, 8, 9. Nearly there. 10. Fantastic. Okay, we've got one more exercise using these. So if you are finding that you get a little bit of cramp or you're struggling to hold them, give yourself a moment. But we're going to bring them down by our side with the palm of our hands facing ourselves. And we're going to alternate, just going to go one at a time, bringing one arm to the side and then the other. So we want 10 on each arm, so it's going to be 20 in total. So there's 4, 5, 6, 7, 8, 9, 10. Keep going with me. 11, 12, keep counting. 13, 14, 15, 16, you're very close. 17, 18, 19, last one. 20, perfect. Okay. If you rest them down, just give your grip a little bit of a rest, because I know sometimes that can get a little bit of a burn in your forearm. So you can leave that to 1 round if you want to, depending on your own level of fitness or however you feel you've done today. You can go around again and do a round 2 if you fancy it. But just a couple of pointers for diabetes as well. Exercise is very good as it helps the body become more sensitive to insulin, of course. And if you're wondering what insulin may be, if you're slightly new to diabetes or you're not really very clued up as to regarding exercise and diabetes, insulin is a hormone that allows cells in the body to use blood sugar for energy, so it helps the body from that manner. And I've got one question to finish on that you may know, you may not, you can test yourselves. Which pancreatic cells secrete insulin? I'll give you 5 seconds. 4, 3, 2, 1. The answer is beta cells. So if you got that right, fantastic, give yourself a pat on the back, or you can do another round of exercise to celebrate. Okay, I just want to say thank you for taking the time to watch this. Follow and subscribe to the YouTube as well if you can, just to look out for the videos. We have plenty more on the way, but make sure you keep an eye out, refer back to old ones as well, as we've got plenty of good information out there for you. But other than that, stay healthy, stay hydrated. Thank you.